we are going to get into this conversation, which is going to, which is going to be so candid and so transparent. And
Yeah.
you are a doctor.
Yeah.
And when I ask you this question, do you think you are a perfectionist?
Yeah.
You're saying maybe not, maybe yes.
Maybe. Yeah. I'm not sure what a perfectionist. I mean, it's
Okay, look
it's
at me. Look at me for a second.
Yeah.
And when I am a common person on the road, and when I am asking a doctor, so that
Nahin.
question is like, you are going to look at my disease. You're going to think. Your thoughts have to be perfect.
Right.
You have to conclude something perfect. Otherwise, something is going to go wrong with me.
Correct.
Right.
Correct.
So look at me like that.
Correct.
If a person is asking you that, are you a perfect doctor? I
don't think so.
You can't.
Never. I mean, nobody can be a perfect doctor.
For a patient, it's very tricky to hear this.
Correct.
That you are still working on it.
Yeah, but at the same time, most of my patients, when I'm not sure about what is going on, I will have a differential diagnosis.
This conversation is going into a direction where we are kind of questioning your expertise, but I understand that nobody can be perfect, and the doctors definitely don't call themselves as perfect doctors.
Perfect doctors.
And I understand. I get it totally.
Yeah.
Now let's just go into the parallels again, right? Which means that whether you are in your 5th year or the 10th year or the 15th year or the 20th year of your practice, with whatever expertise you have gained as a practitioner, you have gained, it still makes a life. It still has those things attached to your profession, where you are so engrossed into it that you are every day playing with strategies, trying to figure out what is the best treatment for this particular cause, for this particular diagnosis, and if this happens, then this patient is going to be okay or not okay.
Right.
Now, with all these things happening in your life and the parallels that you have, do you think you get into issues, you get into problems, you get into your life and your likes going down, and your life goes totally into your profession, and you're not able to give attention that side?
See, I don't do this for likes and followers, right?
Are the factors which keep a doctor or maybe a person like me or anybody, these parallels keep us alive. Right?
Correct.
Now, when you are saying that you're not a perfectionist, you're not a perfect, nobody can be, you're not a perfect doctor, you live on these parallels, try to get each one of these into your life, do content, not for likes and engagement, but yes, you want to put out something interesting, they like it, but you don't want to budge onto other, because that's human, right? That's human. But then at the same time, the practice and all that is still not at a perfect level, and a patient comes to you and still has to pay what you're asking for.
What you're trying to say here is, the patient is coming to me and paying me my fees just to get experimented upon.
Yes.
I will make a statement which is very much contradictory to what you said.
Don't you think that this should be more transparent? In terms of a common person's understanding on how wrong can it get and how much expensive can it get?
Right.
And will I be able to afford it or not?
I will be at least that much transparent with my patient, where I can tell them this is going to cost you this, and plus or minus this much. Mostly it is never minus, it is always the plus.
It's always a
right?
plus,
So minus, patients don't need explanation, right? Plus is going to need an explanation.
And there is another side to it. You see, you have to understand that the patient also comes with this expectation that you are the one who will give me a definitive conclusion.
Correct.
And then the treatment, of
and
course,
then the treatment,
right?
correct.
So that is also there.
Yeah.
That is also there, right? So there is, if there is screening, then there is policy. If there is policy, citizens would know. I feel. But in this weak system, I feel there is no screening. See, what is the screening I'm talking about? I'll tell you. You might not like it, but I'll tell you. See, the thing is, if you are a lawyer there is no screening. You can deal the way you want to. There
Correct.
are policies, there
Correct.
are laws how advocates and lawyers need to deal.
Correct.
But they have loopholes.
Right.
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 Every system has loopholes.
Right.
But it's like a medicine, the field, and the doctors and their profession is still a very far away thing from common people,
Right.
where they feel that there is no control.
Okay.
Which I know that is not true.
Right.
Because the government is trying to control.
Correct.
The government is trying to put a lot of control.
Correct.
Issuing cards saying you can go to any hospital.
Correct.
You get a card at home. They are not able to figure out who's below the economic earning line.
Correct.
The earning categories. Who is above that? Who is on the topmost? But they're issuing it to everybody. That's my understanding.
Yeah.
Right.
Yeah.
Now, if government is trying to put all these things in place, which is very similar to the systems in the most developed countries in the world, like US,
right?
In that system, still the common man feels that the doctors are not being controlled or screened, because they do what they want to do, they say what they want to say, they charge what they want to charge, they get away with anything that goes wrong.
Right.
And that is why this whole thing, because of no screening, the common man feels they have the right to sit in front of a doctor and say, no boss, you did not do the right thing, and I am going to now get aggressive with you,
Right.
and I'm going to do what I want to do. Do you think this is the reason?
So to answer this, I will give you a little background about the systems that are already in place since years together, since decades together, and what the Indian government is trying to do with it.
But tell me honestly, and this it's going on in my head, so I have to ask this. And tell me honestly, you never link the charge of any initial diagnosis and the treatment and the surgery and the following with any of your parallels?
I can have that fantasy in my head, but I mean, if I have the fantasy, my patient should not be paying for my fantasies.
You really think that this plays a big role in patients understanding your body language, your spoken language, the way you talk to them, the way you tell them, look, this is what has happened to you, pyar se, has ke, showing that, empathy, sympathy.
Correct. Empathy is the word.
Yeah, empathy. So a lot of doctors show a little sympathy too. Yeah. That don't worry, like that.
You'll be fine. Yeah.
And that works for the patients not being aggressive.
Correct.
So you think patients being aggressive, sorry to interrupt, but then you think patients are being aggressive because they feel that you've done something wrong to them?
No, it is a lack of clear communication.
It's a lack of clear communication.